Hello, this is Nancy Harvey with Opargo. Welcome and thank you in advance for your time today. There has been a ton of buzz in healthcare as of late surrounding predictive analytics. Opargo has taken real-world problems that many healthcare providers struggle with and provided strategic solutions. Let's take a look at how predictive analytics really works. It is absolutely within your reach. Healthcare practices have some common struggles. Practice goals are lost and not being followed when patients are scheduled. Your day gets wrecked by no-shows, last-minute cancellations, and incorrectly booked visits. Patients are being scheduled on a first-come, first-served basis and not based upon visit acuity. Provider schedules are filled with visits that they shouldn't be seeing. This is typically a result of physician extenders not being properly utilized and uneducated schedulers dealing with complex scheduling rules and preferences. This leaves practices with unhappy providers who are getting burnt out and watching their reimbursement decline. Worst of all, patients may not be receiving proper care. We can do better. The founders of Opargo took the same technology that the airline industry has used for years and applied it to healthcare. The airline industry uses predictive analytics to make sure that each airplane leaves the runway maximized to its fullest. They watch our trends. They know that a business traveler will present on Friday, want to fly on Monday, and will be willing to pay more for that seat than a family of four would have in advance. So what do? They hold a seat on that plane knowing that it's going to happen. We are doing the same thing with the provider schedule. Answering the question of how can we make doctors be the right kind of busy? The answer was to create an optimization engine that uses past data to prioritize patient visits based upon the practice goals. This engine provides the best appointment time for this visit, taking many parameters into consideration. Opargo integrates with your practice management system in real time. Opargo checks your practice management system for the provider's availability on the appointment schedule. We then take the available appointments and run them through the optimization engine, presenting the correct visits for this patient. When you schedule in Opargo, it then passes that information back into your practice management system, looking like you scheduled it there to begin with. The workflow keeps all downstream activity in place, such as patient engagement, billing, and clinical workflows. Every Opargo engagement starts with an analysis of 12 to 24 months of the practice's data. This starts from the moment the appointment was scheduled, who referred the visit, what did they call it, what was its duration, and what did it turn into from a CPT perspective, and how do different insurance carriers reimburse for the exact same visits. We use this data as a guide to make recommendations for improvements coupled with provider preferences. When our patient calls for an appointment, we've created technology that first prioritizes based upon the urgency of the patient visit, then applies optimization parameters using predictive analytics. Let's take a look at how predictive analytics is put to work in a way that can significantly improve your practice health. The Opargo homepage is used to gather additional details about the visit. By capturing the referring provider and choosing visit types that correlate with services that this patient is likely to receive, coupled with their visit acuity, we are feeding information into the optimization engine. Once I select Find First Available, Opargo uses your past data, current demand, taking into account seasonality, and suggests the appointment times that are the best fit for this visit. Remember when we talked about the airlines holding seats on that plane? This is where the same technology comes into play in healthcare. Depending on the visit, Opargo may not present the scheduler with every available option from your practice management system. First come, first serve is not what we're after. Opargo provides the appointment times that best further the goals of your practice. Schedulers are instructed to select appointments above the fold. We tell them all the time, if you choose appointments within the top 5, no one will yell at you. Let's see what appointments have returned. You can actually see that we have an 11 and 11:30 on Friday at the room office available. We also on Friday have a 10 a.m. at the Seven Hills location. Well, why is it presenting me with an 11 o'clock on the same day before a 10 o'clock on that same day? Well, that's because we've prioritized the room office. The goal of this practice is to better utilize the staff at the room office versus the Seven Hills. So if I'm going to schedule in the top 5, I would say to the patient, well, Mr. Wiley, it looks like Dr. Bricker has an availability in the Rome office at 11 a.m. Will that work for you? Why, yes, it does. If that doesn't work for the patient, don't worry. There's 150 options of appointments to make sure that we can get that patient scheduled. Let's go ahead and select that first appointment. We just strategically scheduled this visit, and the experience was easier for your scheduler and seamless to your patient. This confirmation page indicates that the appointment was received by your practice management software and all downstream activities are intact. Check out the impact that we've made on a few of our practices. Some regions are experiencing a decline in visit volumes. This 20-provider orthopedic clinic is no exception. In the first quarter of this year, they saw significantly fewer patients but made $202,000 in additional revenue. Their revenue per visit went up 19%. They worked less and made more money. They will tell you that the only thing that changed in their practice during that time is that they started using Opargo. Another practice was having difficulty distributing complex patient visits throughout the day. Wanted to prioritize pediatric visits, and of course make sure that patients who needed care the most were prioritized. Take a look at their results. Their number of visits and revenue increased, and their scheduling followed the goals of the practice. Opargo also made it easier to onboard new staff. This pain management practice was experiencing a decline in revenue and had patients waiting 4 weeks for a new patient appointment. That's just too long for patients that are in pain. This resulted in seeking care elsewhere. Because Opargo holds appointments for patients who need care the most, this practice saw a year-over-year revenue increase of $71,000 in 3 months. They also had an increased utilization rate of 5%. Promoting patients with the most acute symptoms resulted in higher surgical conversion rates for this group of orthopedic spine surgeons. Providing excellent patient care and increased practice efficiencies is a common theme throughout these success stories. People ask me all the time which specialties we work best with. The answer is any practice who schedules appointments, either has excess patient demand or complex scheduling rules, or of course both, as is commonly the case. It's also helpful for the practice to employ an executive team who gets what we're doing. Changing the way that the practice schedules appointments can cause some emotional responses. Strong leadership that understands and enforces the business goals behind the change helps a bunch. Each Opargo engagement consists of 2 steps. The first step is the data analysis we talked about earlier. We call it optimization readiness. This consulting project returns a 30 to 40 page study of the practice's current state. This study produces a compelling look into the opportunity for Opargo to make a big difference. Each analysis is complete with a move-forward plan, including our estimation of their return on investment based upon their very own data. Once the results have been reviewed, the practice can decide if they would like to move forward into full Opargo usage. Opargo uses the optimization readiness results as a roadmap for the implementation. Most implementations are a 30-day project that moves along at a pretty easy pace. We do most of the heavy lifting using our time with the practice for validation of our proven processes in their environment. Training on Opargo takes about an hour. 30 minutes of that is spent dealing with change management, why we are making the change, and general cheerleading. The other 30 minutes is spent learning Opargo's 3 easy screens. Once they've been trained, each user goes live. How can Opargo help you keep up with our ever-changing healthcare landscape? Here are a handful of things that we hear all the time. Why should I use Opargo? Opargo solves issues practices have always had, but didn't know how to fix. I heard a CEO once say, "We can't change which patients walk in through the front door." Actually, you can. How do I know it will work? While our technology is proven in the airline industry, this concept is new to healthcare. The optimization readiness engagement and our simulator tool show potential customer projected results prior to implementation. This one's a biggie. Our scheduling is fine. If you walk away with Opargo as just a scheduling tool, I have completely failed at my job. Opargo is a practice optimization tool that uses the point of scheduling as the starting point. We are in a cost-cutting mode, also a biggie. There are only so many costs that you can cut. If we strategically schedule your visits, we will see increased efficiencies and revenue will follow along. Medical practices have not had the tools to hold their schedulers accountable. If the scheduler didn't get yelled at today, congratulations, you did a great job. Good enough is no longer good enough. Scheduling can be strategic, and we can use technology to promote practice health. Remember this, Opargo helps practices prioritize patients who need care the most. The goals of your practice are completely automated so that the schedulers can just provide great customer service and be nice. As you have seen, many practices experience revenue growth as a result of this excellent patient care. Opargo will prove to you with your own data that we can make a big difference prior to implementing any technology or workflow change. Opargo currently has full integrations with Allscripts, Athena Health, Centricity Practice Solution, and Greenway Prime Suite. If you are ready to improve patient care, prevent physician burnout, and increase practice health by simply changing the way appointments are scheduled, we should talk. Here are a few ways that you can get in touch with me. Let's work together to continue to bring healthcare up to speed with additional technology that's so desperately needed. Thank you for your time, and I look forward to working with you.